Representatives from United Nations member states, health experts and mining companies are meeting in Sandton to deliberate on how artificial intelligence can be used to detect TB and other occupational lung diseases. South Africa has one of the highest TB burdens with over 50,000 deaths annually. Newzroom Afrika's Nqobile Madlala has more.
The fight against tuberculosis is being taken to the artificial intelligence field. There are already 2 mobile X-ray vans traveling around Gauteng testing patients. This is part of South Africa's effort to combat TB, which kills at least 54,000 people annually.
After we take the image within a few 2 seconds or so, it appears on the screen, and that's the screen, which is this side, is the one that is showing us the AI component. So basically the AI is working at the background of processing the information, of giving you a result of what's happening inside the patient. So it's able to indicate on the image immediately within 30 seconds. If ever the image is either normal, that it means there is nothing that is picking up on the patient, or it can indicate if ever the image is suggestive of TB, that means the patient is prompt to have a TB or just got other abnormalities.
It's estimated that 36% of people with TB worldwide are undiagnosed. Experts in the conference say over 3 million people are also not diagnosed on time due to the heavy reliance on symptoms, which highlights the importance of computer-aided detection.
Before 2010, we were using microscope to test tuberculosis. So we take your sputum. If we suspect you have TB, we put it in a microscope and we check whether you got tuberculosis or TB. And we would find that only 50% of those who actually have TB.
Stakeholders at the conference are looking at the possibilities of using computer-aided detection for silicosis, which is an occupational lung disease.
It's this silica, once it gets into your lungs, it causes something called fibrosis, and it's over time. So because it doesn't end there, so it's a continuous inflammatory process. So people actually get this disease maybe 10 years, 20 years, or 30 years, even after leaving the mining industry. And because of the fibrosis, then they are vulnerable to TB infections. They actually have got about 3 times the risk than the normal population.
Southern Africa Miners Association says those affected by occupational diseases and their families should be supported.
You talk of 9 different countries, including South Africa, from across the region. Plus 1.6 million people got affected. Large some of them are no longer, but their beneficiaries are there, their spouses are there, and so forth, which is the widows. Critically to this, 1, let the National Department of Health, and I'm calling upon the Minister once again, to fast-track the process to amend ODIMWA so that the system is empowered to have resources to find us and test us.
The conference is expected to conclude on Saturday. For Newzroom Afrika on Channel 405, I am Nqobile Madlala in Johannesburg.